Welcome back to Smitty's Learning Room. Today we'll continue having a look at the sports medicine option, but we move on to the next focus question. How does sports medicine address the demands of specific athletes? In this video, so we're going to start having a look at children and young athletes, and specifically looking at the medical conditions which children and young athletes suffer from. So as mentioned before, we now move into a new focus question for sports medicine, and we are having a look at how does sports medicine address the needs or the demands of specific athletes. And when we have a look down in the syllabus, we look at this concept that children and young athletes, they suffer from medical conditions, overuse injuries, thermoregulation and appropriateness of resistance training. And we need to analyse the implications of each of these considerations for the ways that young people engage in sport and how it's managed. So this video is going to have a look at how children and young athletes suffer from medical conditions and how they can be managed within sport. So we'll start by having a little bit of an overview of some of the issues that children and young athletes face or are presented with in relation to sport. So we've got medical conditions, we've got overuse injuries, thermoregulation and appropriateness of resistance training. Now this video just looks at medical conditions. There's quite a lot of content to cover, and a video later on will look at overuse injuries, thermoregulation and appropriateness of resistance training. So let's start by having a look at what are the main medical conditions which sports practitioners need to make themselves aware of when dealing with young people, and they also need to be aware of the correct treatment of these medical conditions. So we've got asthma, diabetes and epilepsy. Now I'm just going to go over a few things from asthma in case you've forgotten from our preliminary first aid course. Now asthma is a chronic medical condition, and people who have asthma experience shortness of breath due to tightening of the bronchioles, and this can be an issue for young people playing sport due to a decrease in oxygen supply. So if we have a look at the picture here on the left, we see that this is a normal lung here, and we've got the bronchioles, which is this main airway going into the alveolus. Now, a normal lung, the muscles are just relaxed and they're working to get the air in and out of the lungs. But with someone who suffers from asthma, the shortness of breath occurs because these bronchioles actually narrow, and the muscles around them, so you can see the dark red bit here, actually tighten, and so therefore air doesn't get in and air can't get out as easy. So it's almost like we're strangling our bronchioles and we can't get the air in and out. So as a practitioner, what are some of the signs and symptoms that we need to look for when we know we have an athlete with asthma? So if an athlete's suffering from an asthma attack, they're going to be wheezing or have a shortness of breath or a tightness in the chest. So they might be complaining that the chest is quite tight or be having trouble breathing. Now causes of this can be dust, pollen or smoke, or increased exercise. Now when we look at exercise-induced asthma, this happens to some young people because of physical activity, and it's usually due to endurance sports. Now it's really important that practitioners don't get asthma confused with just a general shortness of breath from an increase in physical activity or an increase in heart rate. And obviously it's really important that athletes or young people who have asthma need to make their coach or their team manager aware of that, so that they know to look for these signs and symptoms and not to mistake them for just a shortness of breath due to exercise. So when we have a look at the treatment, we look at the Asthma Australia treatment or first aid, and the first thing we need to do is to sit the person upright and just be calm and reassuring to the person. Don't leave them alone, just let them be comfortable. Then what you need to do is have their puffer. Hopefully they have their own puffer on them. If not, there should be one in the first aid kit. We shake the puffer and then put one puff into the spacer. Allow the athlete to take 4 breaths from the spacer and then repeat until 4 puffs have been taken. So it's a simple process of shake, puff, 4 breaths. Then what you need to do after 4 puffs have been given is to wait 4 minutes. If there is no improvement, give 4 more separate puffs of the reliever, exactly the same way, so shake, puff, breath. If there is still no improvement after the second bout of 4 separate puffs, that's when we need to call 000 and get emergency help. If you If you call 000, tell the ambulance that someone is having an asthma attack. Once you have called for emergency help, keep giving 4 separate puffs every 4 minutes until emergency assistance arrives. It's important for sports practitioners to understand this process so that they can administer asthma first aid if a player is having an asthma attack. If first aid is not administered, this can actually cause a life or death situation and cause further damage to the athlete. The next medical condition we have a look at is diabetes. Now, the incidence of diabetes amongst young children and athletes has increased. And because of this increase, it's important for coaches to understand what diabetes can actually do to a child or a young athlete. Now, before we start, let's just actually have a look about what is diabetes and why does it affect people. So diabetes is a chronic metabolic disease, and it's identified by high levels of glucose in the blood. And so what basically starts happening is that the pancreas either makes little or no insulin, which is what we see in type 1 diabetes, or it makes insulin, but glucose can't get into cells. Now, for us to understand the complications of this with young athletes is that we know that glucose equals energy. We learned that in Core 2, so it provides us with energy. And insulin allows the body to use glucose for energy. So if our pancreas isn't producing enough insulin or none at all, then the glucose builds up in the bloodstream and it can't be used for energy. If we have type 2 diabetes, we actually have insulin and glucose in the bloodstream, but the insulin is ineffective and the glucose can't get into the cells and builds up in the bloodstream. So basically what we're looking at here is we've got too much glucose in the bloodstream. That's the common factor in both types of diabetes. Now, type 2 diabetes is becoming an increasingly serious issue amongst children and young athletes because of increased obesity rates. So when we have a look at the impact of diabetes on young people, it's quite significant in relation to their participation in sport because their body uses glucose for energy, and if the body can't use glucose, the athlete doesn't have any energy, and this is where problems can arise. So let's start by having a look at the hypoglemic episode. Now remember from first aid in Year 11 that a hypoglemic episode occurs when blood glucose levels fall below the normal range. And some symptoms for this will be an increased heart rate, sweating, shaking, dizziness, anxiety and confusion, or altered consciousness. Now, if an athlete knows that they have diabetes, they're most likely to be able to understand these triggers and let the coach or the sports practitioner know. So that further harm doesn't get placed on the athlete or the young person, it's important for the sports practitioner to understand the treatment of a hypoglycemic episode. And so to start with, they need to consume fast-acting carbs. So these are things like lollies, fruits, juices, or soft drinks. And then once they sort of come back down again and their heart rate decreases and they're feeling a little bit more stable, they need to consume further carbohydrates that are a bit more complex, such as bread or a banana. So the opposite to a hypoglycemic episode is a hyperglycemic episode. And this is when the blood glucose levels rise above a normal range. And again, like someone who's experienced a hypo, if an athlete knows that they have diabetes, they're probably likely to be able to detect that this is the issue and will seek assistance from coaches or sports practitioners for treatment. Now, some of the symptoms for the hypoglycemic episode are thirst, vomiting, excessive urination, rapid breath, a weak pulse and a rapid pulse. So the pulse will be quite fast, but it's very weak, and drowsiness. Now, the medical or the treatment for this is to seek medical advice, and the athlete may have a diabetes plan. So depending on the age of the athlete, they may have steps that they follow through, such as the injection of insulin or something like that, to assist with this. It's really important that to identify that an athlete having a hyperglycemic, not to give them carbohydrates or sweet things. This will actually cause further damage to them. So it's important to understand that the symptoms between the two are very different. And probably the most common one with the hypoglycemic episode is that the thirst and the vomiting, or even just the excessive urination, as opposed to the shaking and dizziness with the hypo episode. So when we have a look at diabetes and exercise, we know that exercise helps people who suffer from diabetes maintain their blood glucose levels, and it also assists in weight loss. Now, this is obviously very important for people who suffer from type 2 diabetes, because usually the reason they're suffering is a result of excessive weight. Athletes need to take extra measures to maintain blood glucose levels in both training and play, and this includes monitoring by the coach or trainer. So this is why it's essential that a sports practitioner understands which athletes in their team suffer from diabetes, but also understands the way to identify and also administer first aid for people with diabetes. So in supporting these sorts of athletes, coaches need to allow for drink and food breaks before, during and after activity, as well as monitoring the athlete for obvious signs and symptoms of a hypo or a hyperglycemic incident. So the final medical condition we look at in this video is epilepsy. Now, epilepsy is a result of a disruption to normal electrochemical activity in the brain. And when this disruption happens, a fit occurs. Children and young people who suffer from epilepsy are encouraged to play sport, and the reality is that with modern medications now, a lot of epilepsy for young people is treated through these medications to allow them to undertake everyday tasks and be able to participate in things like sport. So we know that epilepsy is caused by an abnormal electrochemical imbalance in the brain. But when this happens, things that a coach or a sports practitioner needs to look out for is the presence of a seizure or shaking or fitting, and the athlete may also be absent, and so just sort of looking at you but not really there. And these signs and symptoms will be known to the coach or the sports practitioner, and that's why it's really important for a child or a young athlete to identify to the coach that they do suffer from epilepsy, so that they can pick up these symptoms a lot faster. Now, when we look at treating an athlete with epilepsy, the main thing is that we do not restrain the athlete. So do not try and hold them or push them onto the ground or hold them tight. You just need to make sure that you move away any objects of further harm, and try and sort of place soft things around them if you possibly can. Once the seizure is over, place the person in a recovery position and loosen any tight clothing. Now, if the seizure lasts for more than 5 minutes, call an ambulance and seek further medical assistance. So we've started by having a look at the medical conditions which children and young athletes are exposed to. So that's asthma, diabetes and epilepsy. And in the next video, we're going to have a look at how overuse injuries, thermoregulation and the appropriateness of resistance training can impact children and young athletes in sport.